benign or non-cancerous growth, conjunctiva of the eye. The conjunctiva is a clear, thin tissue that covers the white part of the eye, known as the sclera. Pterygiums may develop in one or both eyes. The lesion is characterized by a pinkish, triangular-shaped tissue growth of conjunctiva that extends towards the cornea, a transparent window covering the front of the eye. It usually occurs on the nasal side of the eye. The color of the lesion varies from pink to red in color. It may be small or may grow large enough to interfere with vision. A pterygium is also called surfer's eye. Causes. The cause of pterygium eye disease is not known, but it can occur more often in people who spend time outdoors with frequent or excessive exposure to sunlight or wind. People who spend considerable time in the sun, such as farmers, fishermen, and people living near the equator are more likely to develop pterygium. Genetic predisposition is another factor that may play a role. Symptoms. The primary symptom of a pterygium is a painless area of elevated tissue with visible blood vessels on the inner or outer border of the cornea. The condition can cause extreme eye discomfort, including burning, irritation, redness, tearing, foreign body sensation, and astigmatism, visual defect. If the growth becomes large enough, it may begin to inhibit vision. Diagnosis. To diagnose pterygium, your ophthalmologist or eye doctor conducts a complete physical examination of the eye and eyelids. No special tests are necessary. Treatment. Treatment depends on the size and extent of the pterygium. Treatment is usually not required in mild cases. When a pterygium becomes red and irritated, steroid eye drops may be prescribed to reduce the inflammation. If these drops are recommended, you should remain under the care of your ophthalmologist. In cases in which the growth is unsightly or vision is threatened, your ophthalmologist may recommend surgical removal of the tissue. The patient will be provided preoperative counseling to inform them that although surgery is usually successful, sometimes the symptoms are not completely relieved. The recurrence rate is frequent and tends to spread quickly after recurring. The most common surgical technique used today involves a simple excision of the pterygium, combined with conjunctival autografting. During the procedure, the pterygium is removed, and the gap in the conjunctiva left by the removal of the pterygium is filled with a tissue transplant from the upper eyelid. The graft is held in place either with sutures, fibrin sealant, or glue. This graft covers the excised area and acts as a barrier to recurrence. In some cases, following simple excision, a topical therapy and